Welcome to the Health System CIO show. I'm your host, founder, and editor Anthony Guerra. On today's episode, I'll be speaking with Terri Couts, SVP and Chief Information and Digital Officer with Sharp HealthCare. Terri, thanks for joining me today.
Oh, thank you so much, Anthony, for having me.
All right, great. Let's start out by talking a little bit about your organization and your role.
Yeah. Sharp Healthcare is an integrated system in San Diego. We're highly managed care, so capitated population, about 350,000 lives. We have now 10 hospitals, five acute and five specialty, and we have a couple physician practices that we work with in our own health plan. So pretty dynamic and yet complicated health system that makes things very interesting.
Yeah, for sure. So you started over there about 11 months ago, is it?
That October of last year, correct?
Right. So, lots of interesting stuff we could talk about there. I'm always fascinated with an executive like yourself starting in a new role, the approach to getting acclimated to the environment, meeting the right people, what your objectives are. People talk often about listening, trying to go around and talk to everybody, starting to
Mhm.
build those relationships, maybe starting with some small wins, showing people that they've been heard, the low-hanging fruit stuff. What was your approach, when you went in? What were you trying to do? And, people talk about 90 days, all these kind of things.
Yeah. I think I just wanted to seek to understand. California is certainly an environment that has a lot of different regulations that I wasn't accustomed to in the past. I have come from organizations that was primarily a hired physician model, an employed physician model. And in California, that's not a model that exists. So they have these IPAs. Just trying to understand, what's their pain points, where do they see the challenges, what's important to them, and just changing the dynamics on how ISD is thought of at the large organization. So we're a, uh, a system service. But each of our entities that we serve has just a little bit of a different complexity, a little different need. So I'd like to get out there around, see the technology in use, have people see me as a person and not just somebody sitting behind a desk. And then that way we can start to have an understanding on how we need to work with each other.
Yeah, very good. So it's kind of a go around, listening, pain points, trying to figure out the perceptions of the IT shop. Are we seen as a place where ideas go to die, or are we
Yeah,
seen as a resource that helps people do their job? And when things aren't working well, we
exactly.
address that. So I guess, it's always interesting. There's a combination of listening, sort of the anecdotal, and then you could try and get harder data and some kind of surveys approach. Were you trying to do both of that, or what were your thoughts on how to figure out that sort of at a high level? What do they think of the job we're doing over here?
Yeah, I didn't start with surveys because I think in order for trust to start to form, they need to see me as a person and understand how I work and operate as well. I think Sharp has always been known as a very innovative healthcare system. I mean, they've been doing fully capitation for a couple decades now, and so it's not something that's new for them. They have great physician leadership, great investments in systems. But I did hear that even during my interview process, that when they implemented Epic a couple years ago, it's still talked about as if it was a COVID event.
Hmm.
And so when what I mean by that is, we reference COVID, like before COVID and after COVID, and
Right.
there's this kind of like feeling after COVID that things got harder, right, in
Hmm.
healthcare. I think it's a similar thing with Epic. There was this before Epic and after Epic, so I wanted to understand that Epic obviously is a great EHR. But if you implement one Epic, you implemented one Epic. It is highly configurable. And so wanted to understand where we had our pain points. And then also, how does the team interject with those pain points? And try to get back, because what I was hearing from my ISD team is they felt a little bit beaten up, responsible almost for the feelings that the organization had around the Epic install. And so I needed to get ahead of that. My goal was that we didn't talk about Epic in the same light, by next calendar year. And I think we're well on our way for that. Because, there's a lot of things that we can do here at Sharp that does not necessarily involve Epic, and we had to get over that hurdle.
That's a really interesting point and a good point. You talk about innovation. Innovation is kind of second level stuff, right? So if our main software we use here at most health systems is our EHR, and at a lot of places it's Epic, and you can see that perhaps we're not where we want to be with that implementation. We don't have the level of use and satisfaction. So there's a lot of work to do there, right? So
Right.
that's a great place to focus. It's like we have some baseline stuff to do here to get everyone sort of over the curve on just the implementation, the optimization, get everybody kind of happy with Epic, and then we could talk about sort of second level innovation and doing cool stuff. Does that
Yeah.
make sense?
100%, and that's what we've been focused on. To be honest, I say it in the sense of like when you have a house that you've built up from the ground up, and you're still building and you're adding all of these renovations to different rooms. But if you don't take care of the foundation, things start to crumble underneath you. And we had a lot of holes in our foundation, and so even from the way that IT processed things to how it got communicated out, and understanding the needs of the business. And so we really kind of peeled that back and said, okay, let's start fresh. Let's look at our governance process. Let's look at our systems and the complexity of the ecosystem that we have. We have about 1,400 plus apps,
Right.
which makes it very complicated to maintain. And if you have a lot of people maintaining those, you don't have a lot of people doing, grow and transform activity. And so we wanted to kind of do a relook on all of the things that I think was maybe neglected for a few years because they were so focused on innovation.
Yeah, 1,400's a lot, and that's with Epic, right? So there was probably some major consolidation down from go. I
That's
know
correct.
you certainly consolidate down the EMRs. I think I read you went from like four to one. Uh,
Mm-hmm.
but that doesn't mean all the niche stuff went away. That's really got to be its own focus. And I just did I've had lots of conversations on this. Um, and we did a webinar on this recently where sort of the takeaway, one of the takeaways really interesting is it's a bear of an endeavor, and a lot of times at the end you don't get the reduction you'd hope for at the beginning.
Yeah.
So it's a tough one. Turning anything off is so tough.
Yeah. Well, people get tied both emotionally and the whole change management about it. They like things the way that it's always worked without being able to rework, how that impacts them. One of the things that Sharp has done and will continue to do is when we look at the value of these systems, they report out on the value realization. So they were reporting out on the value realization as it came to implementing Epic. So could they do clinical care in a different way that had either financial or clinical outcomes that drove population health? Which I think is the right approach. Oftentimes we implement a system thinking the system's going to solve the problem when really it's the change in the process and the people supported by the system that solves the problem. And Sharp was looking at it in the right way. We just had to get a little bit more streamlined, and instead of having the best in breed for all of these systems. And I'm sure that at the time that they were chosen, it was a great idea. But when you're looking at reducing spend in IT, particularly because our margins continue to kind of get smaller and smaller, and it's harder to get paid for the work that we do, reducing complexity, it reduces downtimes, it reduces the need of people time. There's a lot of things that you can do with app rationalization that enables you to be innovative in other ways. And innovation doesn't mean buying something new. Innovation
Right.
means making something, taking something existing and making it better, transforming the work.
Right. So I would imagine that's one of your big goals is to get that 1400. Like we've got the Epic platform. We know we're not where we want to be on that. We want to work on that. We want to get, and this all ties in, everything ties into the governance you talked about, right? So step one is what are the things we need to do? And then let's prioritize, right? So I mean it's so complicated. You've got top-down approach to what needs to be done. You've got your objectives, your strategic objectives as an organization. You want IT's objectives to dovetail with those. So there's a top-down element of what IT should be doing. And then, of course, there's a bottom-up element of what our
Mm.
users are saying that they want and need. So, but everything's got to be organized and make sense. Otherwise, everything's coming at you from all over the place. There's different streams where things are being prioritized and organized, right? We have to get it
Yeah,
all together. That I think that, and when I interviewed Dr. Korn, and he was so excited, he said, "You have to talk to my CIO. You have to talk, Terri. You have to talk to her. She's doing an amazing job around governance." So you're doing something, getting everybody. Part of it's getting everybody to feel heard, right?
yeah.
In an organized way. So your thoughts there, wherever you want to jump in.
Yeah, I mean, obviously, you want to make sure that you have the right players in the room, that have the ability to make the decision as well. And we have three core strategic imperatives, and one of them is unify. And that means we have to be standard across, not only our systems but how we use our systems, so that we're producing data that can actually drive change across the organization. So we set up we had a lot of advisory committees. So much like when you implement a new Epic install, there's a bunch of advisory committees, and they do have their purpose at the initial install, but wanted to transition away from advisory committees, have those advisory committees, if they still function, feed into what we should be working on, but the decision makers needed to be at the right level to be able to drive those decisions. So not only is this what we should be working on, but also could we work on it? So the feasibility of it, do we have the resources? And then what's it driving? What's the outcome we're hoping to achieve? Setting those, how do we measure it? But then also, is it the right thing at the right time, right? So what is it supporting in our strategic plan? And we have a couple of different things that we're working on, and just because we want to work on something and it sounds like a great idea, it might not be the right time, and we have to be okay to say we don't have the right resources now and have the ability to say no. And that was something that I don't think that our ISD team had the ability to do, because they felt like they needed to serve the organization, which meant they had a lot of border askers, and we didn't have the ability to say yes or no to one or the other without this governance process. And governance is not something that's fun, right? It's not fun, but it's definitely fundamental, and it should help drive where you're putting your demand and capacity efforts to, and having the appropriate data to support. When I first joined, we were talking a lot about, we don't have enough resources, but I didn't have any data to say this is what they're working on and should we move something else, right? And so when you bring something to the table and it's something that you want to work on, the question should be the feasibility. Do we have the ability to do it today? If so, great. If we don't have enough resources, what are we moving? If we don't want to move
Yes.
something,
Yes.
then are we buying more resources to do it, or whatever the need is? And those, we didn't have the framework for those questions to be answered.
Yeah, that's great stuff. And what you just said is something I hear, I've heard before. Um, it's a way of positioning the discussion. So a couple things here. Number one is, um, I just jot down notes as you're talking. It's the idea that it's not IT saying no. It's the committee that's properly constituted with the right voices that perhaps is saying no, and IT is a voice on that committee that helps perhaps contribute to that decision. So
That's
the
right.
committee, which includes your colleagues and users, whoever's making the request, has said no or not now. So that's one thought. And the other thought is the idea that you mentioned of, this whole thing about transparency. If a request has come in, people want to know, well, up, thumbs down, or what? At some point, what's going on with my request? Um, and the positioning you mentioned of responding back with it takes an understanding of the capacity of either your department or capacity in general to say we're at 100% capacity with the projects we have. You're requesting something new. Uh, Theoretically, we could do this thing, but we wouldn't be able to do this other thing, right?
Yeah.
So it's that understanding, but it takes the confidence of knowing that you have your organization operating at, let's say, 100%, right? We're operating at 100%. As you mentioned, your other alternative is we either not going to do something on this list that we'd planned to do, or you're going to have to give us more resources so we have more capacity. A
Right.
lot of stuff. What do you think?
Yeah, I mean, and we're supporting that through data, right? So we just started tracking our analysts or our IT staff tracking time against task.
Mm-hmm.
So they have, and it's not about timekeeping or it's not our timekeeping system. But if we have allocated 30 hours a week per analyst to work, and they're already working 35 hours based on the work that they're doing against the task, we're already over capacity. And then you could flex and be able to use through essentially a heat map that we're developing to say
Mm.
this project or this request is going to take XYZ resources, and this is the heat map that those resources fit into. When do you want to do the work? Can you wait till September? Does it have to start today? Because the conversations change depending on the needs of the business, and it's us really just influencing the conversation with the appropriate data points and allowing them to drive the decision making. So it takes that out of that kind of that where IT is doing something to them. Is really it's a partnership.
Yeah, it's fascinating. I find it really interesting if you can go a little more into the idea of understanding capacity of an IT department, and that's just not one thing. It's skills, right? It's specific skills. So you may have a certain amount of a skill set on your team, and that particular skill set is being used up for the next 3 months. You need to be able to understand all that and produce that in some visual or data presentation that says, well, here's why we can't do your thing. It gets very nuanced in the communication and understanding, and you need tools. And we're not looking to get into the, vendor names, but you need tools and you need ways of understanding what you have, where it's going, what it's committed to, and then juxtaposing that against requests, and doing it in a way that doesn't take all day every day, right?
Right. I mean, sure, you don't want to have analysis paralysis, right?
Right.
So you certainly want to keep things moving because you don't want the governance to be the bottleneck, or otherwise nobody's going to use the governance process. But I think, the data collecting, probably the hardest sell was with my team, right? So it's one more thing that they have to do. They already do, track their time.
Right.
But we wanted to get granular in the fact that so that we can address the skills, address the projects that they were working on. And some of these projects, they may only need 2 hours this week, and they might not touch it again until, for another 3 or 4 weeks because they're waiting on somebody else to do their work. And so it is very nuanced, but the more refined we get,
Yeah.
the better informed we get. And so not only do we get the ability to help make the decision on if it's now the feasibility of it. But also when I have things that are like, if our radiologist groups are growing, or our imaging volume is growing, and yet my resources have not grown, I have the ability to pull that data to say, this is why, maybe we're not getting as fast responses or those things, because it supports many different avenues, but the data has to be there in order to do it. So I had to get my team on board to do that. And it was not an easy endeavor. They have to see, what's in it for them as well. But I do think it's gonna, I've done this at Guthrie, my previous organization, and it got to the point where we just had to present the heat map and the operators made the decisions. So I think we can get to the same place here.
Yeah, it's really fascinating. And I assume it's useful for you in many ways to have that level of data. The idea that it was a little challenging to get people on board is interesting. Not surprising, but interesting. I mean, I get that. I can understand that, but it also allows you, I would imagine, to um, think about how you're going to position your resources or your resource mix going forward. If you can see consistently over months that you're short on a particular skill,
Exactly.
and you have someone move on or someone resigns, and you say, "Oh, are we gonna fill that position?" Well, let me look at how our skill set is being used. Well, we're always short with this skill set, and we're actually over capacity with the skill set we just lost. So let's change that position and put it over here. I mean, right? But yeah, as you
Exactly.
said, it's all the data.
Yeah, and it's really hard to benchmark IT data, and particularly in healthcare, against other orgs. You try it with all kinds of different vendors who have done it through, work volume and like nursing work hours and things like that. That's easier because it's based on your patient volume, where, in a system service like ours, it's not as easy. It's really based on the kind of work that you're doing. And so this gives us the ability to um, shift or even cross train, or, it really helps us keep a pulse on our organization.
Yeah, so the governance is a big thing. We get that organized, we get that straightened out, and the goal is so we're working on the right things. Um, and now we're working on the proper things based on the requests coming in and our strategic objectives. Another sort of big issue that comes up with running a solid IT shop is the importance of you're a nurse. So, the importance of staying close to operations. Many IT personnel that didn't come up through operations can just get better and better and better at their job the more they understand the operations of the people they're trying to support. Um, I've heard that, over time with people going remote, you brought up COVID before, something was probably lost. Um, if someone's fully remote and they're not steeped in operations through the evolution of their career, it can be challenging. People, IT professionals like to talk about the importance of going to Gemba, getting on the floor, um, getting to know your users, and you'll be better at your job. So, your thoughts around that, and what, if anything, you try and do to make sure your IT team stays close to the people they're trying to serve.
Yeah, I mean, it's probably one of the most important things that we do. Healthcare is so people focused, and in order to be people focused, you have to have strong relationships. And I do think that that was lost a little bit with COVID and going remote. However, I'm not a bring everybody back 100% believer as well. I think that there's a lot of work that can be done remotely, and to support the staff member with whatever needs they have in their personal life as well. So that as long as the work is being done during most of the core hours, I don't care if you log on at 6 in the morning or if you log on at 8. To me, that doesn't matter. What does matter is that you understand the problem we're trying to solve, that you understand how the technology is either enabling or becoming a barrier in patient care. And in order to do that, you do have to ground. I'm a big believer in rounding. I round on a consistent basis, and it's something that I've encouraged my IT staff to do as well. And it's hard when you get so bogged down with meetings, but once you get out there and you do the connection, and I've had some people around with me, and it's brought them joy to even just hear some of the comments, particularly even what I mentioned about earlier about Epic being this COVID event. So they had this perception that they had this deep responsibility of like doing harm to our caregivers because the deployment was perceived to be so bad. However, like when you go out there and you talk to the individuals, like they have pain points, but there's a lot of good things that are going on too, and they will tell you that. And they're particularly, at Sharp, everybody is so appreciative of the work, and you have to hear that as well, so that you say, okay, what the work that I do matters, because we're all in this not to make money. I mean, that's not. It's really about the mission of caring for people. And I know when I first joined in October, at the end of October, we had our first in-person manager meeting since prior to COVID. And just
Wow.
seeing the like energy in the room and like people connecting with each other and giving each other time, like those relationships are really, really super important. So we are bringing some work back in-house where there's conversations that are happening. You get to understand each other, and I think also going out to the floors and understanding how it's being used is just as important.
Yeah, like you said, you can bring a lot of joy and a nice mix of remote and in person. I don't know if it's great to be in our house all day. It's
Yeah,
a couple days a
exactly.
week, get in the office, nothing wrong with that.
We're not meant to be loners.
No, definitely not. Do you have any funny stories about people not knowing you're a nurse and thinking you don't understand operations, and you're like, well, actually,
Yeah. Not recently, not here at Sharp, because I think, that was one of the reasons why I've been so welcomed, is because I am a nurse. But, early on in my career, there, particularly during meaningful use, and there was a ton of like implementations happening, a lot of, you don't understand the work. And, I think, um, and maybe that's what drives me to be out there and kind of having a conversation. I think I'm like more of an annoying 2-year-old than anything, where I just ask a lot of questions like, well, why and why and why? Because obviously you get a little bit deeper into what's really the problem when you start to be curious enough to ask. And I've just always found solving that problem to be really fulfilling in my career. And I'm obviously not the one that's coding anymore, but I think that it's really important to ask why. But I had this an, ED doc who it took a long time to get a rapport with. And she was a little bit younger in her career. So, you would think that she would have technology in her background, but not so much. She was very much paper. And I can remember supporting her one night, and we would remote into her computer, and, she'd call me and ask me things, and I would help her walk through. And for a while, so I wasn't on the phone with her the whole time. I would just stay remoted into her computer, and I would see whenever she was struggling, like her mouse would stop, and then I would just move her mouse remotely to the next, and then she'd take it and pick it up. And she was like my hardest challenge, but she also became my biggest fan. So I think, just building, whether it's being clinical, in nature and understanding each other's lingo, or just understanding that change is very personal. She knew how to take care of patients. She just didn't know how to do this computer system that was changing her life. It helps us both kind of get to the end result, which is her getting her patients in and out the door, and us getting her on the system.
Yeah, so that's a great point, and I bet that's a challenge a lot of IT executives face, especially if they're not clinical, is when they're just not getting the rapport with a user that is very influential and very important for them to make happy, so to speak.
Mhm.
But it seems quite challenging, and we all know that clinicians, doctors especially, can be a little challenging sometimes. Any advice there on if you're an executive without a clinical background and you're just having trouble developing that rapport?
I think just having frequent conversations and asking a lot of questions. Early on at Guthrie, I remember when I first joined there, IT had a kind of a bad name as well. And, they would have the ticketing system was called Magic. And so they would say, well, it's where things go to die, ideas go to die. They would put a ticket in and nothing would happen. And I remember like one of the first changes I made was that for my IT team that I wanted them to put their extension in their signature line in their email. And they said, well, they're going to call me. I'm like, I know. That's what I want them to do, because the translation in the ticket itself could be interpreted so many different ways, right? And so
Right,
you had to have a conversation to seek to understand. And I think that people get they take the anger that or maybe the frustration as a personal. It's not personal. It's just we've disrupted how a user cares for their does their job, and it's not just for us. It's like we'll just push the button. For
right,
them, it's life changing, right? It's
right.
one more thing. And so I think just having a conversation, seek to understand, follow up. If you say you're going to do something, make sure you do it. And even if you can't do it, it's okay. But you have to be honest, because avoiding them only makes them more angry.
Yeah, great stuff. I remember the point you made about sort of getting on the phone and having a conversation came up. I was interviewing a chief analytics officer, and she was saying how, I don't want my people just taking a ticket and building a report. Like, you got to get on the phone and make sure you understand what's being
Yeah,
asked. There may be a report that already does it, but they just haven't phrased it exactly right. And that came up in conversations about tickets coming in, people trying to communicate users the problems they're having. It's like if you're standing over their shoulder, you might see something completely different than what they're attempting to communicate to you about the
yeah,
problem they're having, which speaks to them of the benefit of occasional in-person at the elbow. We even call it out
yeah,
the elbow assistance. So those conversations, and as you said, there's a reluctance. Young people that have grown up with a lot of technology, have a reluctance to these in-person, even phone conversations. They live for this asynchronous. Some people have social
yeah,
anxiety now. They have so little regular interaction that when you're saying just get on the phone, to them it's like panic. Like, what do you mean?
yeah, yeah. And I think, it can be interpreted as conflict, and it's not necessarily conflict. And I think it's just, it's your mindset. You have to change your mindset. Again, a curiosity of, what's the real issue. A lot of times when they're looking for technology to solve something, like you said, there may be already something there. If we understood the problem better, we can then apply the technology.
Yeah, curiosity is a big thing. I don't know. I think that's probably the number one thing in what I do. You mentioned it being very important. Maybe it's the number one thing, one of the most important things to be successful at anything, is you have
Yeah,
to be right. So that's a problem with doing something just for the money when you don't really care about the thing. How can you be curious about something you don't particularly care about? So it's kind of an interesting point
yeah,
there.
agreed.
And it could come up in hiring too. Like when you're hiring, are you looking for that? Are you trying to make sure, trying to hear, listen for curiosity to know if they're interested in this and curious, like we can teach them anything.
Yeah, agreed. I think, there are particular skill sets that you can teach. You can teach somebody how to code. You can teach somebody how to, write a SQL query. But some of the skill sets around, being curious, mission driven, being compassionate, those are things that either an individual has or they don't. And so when I'm looking for somebody, those are definitely characteristics that I'm looking at. Obviously, you have to look at skill sets too, but it does weigh heavier on, are they going to seek to understand, or are they just going to, do it for the paycheck and at the end of the day, not be connected to the mission, which is, caring for people.
Yeah. Are there any sort of really deep tech skills like around cloud, managing your cloud environment, where you're like, you know what? They don't really they don't really need to know much that's going on with patients. I mean, this is some deep tech stuff. This is a really unique skill set. It's in demand. I got somebody that wants to work from home, but they know how to do this. Is there stuff like that?
So I think that obviously the things that are less workflow driven have less of that need. However, I think, and I think I said this earlier, there is technology can do one of two things. It can be a barrier, it can be an enabler. And even something like reaching out to the cloud or putting cybersecurity controls around your cloud environment, those are highly technical things. But if they impede the ability to care for patients, then it has the same kind of negative outcome. So I do think they have to have still some connection to the work that they do. And, when there's a patient on the table, how you respond to that is really important.
Yeah. All right, Terry, we're just about out of time. I'll just ask you a final question and I'll let you go. I usually frame it up this way. What's your best piece of advice to someone in a comparable position at a similar sized health system that does not have maybe your clinical background or years of expertise, someone who's a little newer into the role? Just what have you found that's helped you in your career that has helped you be successful?
I think surround yourself with people that support you and can help you fill the gaps that you may not have in your own kind of closet. I'm not a highly technical person, so I surround myself with people that I can reach out to that can help support me, and I think that that's true for somebody who maybe not have the clinical skills, but can still get um, the relationship benefits from being friends with like someone like Dr. Korn.
Oh, there you go, Dr. Corn. Yeah, he's a big fan of yours. So,
Yeah.
sounds like you're a big fan of his too. So, Terry, this has been a wonderful conversation. I really appreciate your time, and I hope we can reach out to you again down the road.
Yeah, of course. Thank you for having me, Anthony. It's been fantastic.
Have a great day.
Yeah, you too.